Hey, my name is Sruti. I'm an author and spiritual teacher, and I write and talk about my experience of spiritual awakening and chronic pain. In 2018, I had an allergic reaction to an ear piercing that radically altered my appearance and my life. The condition, which is rare, is called erythromelalgia and feels like you have a hot frying pan stuck to your ear and face. I was also on prednisone for 6 years, which radically altered my appearance for the duration of the illness. Most doctors didn't think I would recover, but that is why I'm sharing what I have to share, because it helped me get through it, and it can help you get through your problems too. Hope you enjoy. So I'm in a doctor's appointment. The doctor says to me, I'm not a vending machine. My mom is in the room. Doesn't matter. He gets up, walks out, leaves the door open, never comes back. So after that appointment, I went outside with my mom and cried in the car, basically hysterically, not just because it was rude and not just because it was shocking, but because I realized what it meant for my life. And what it meant for my life was that this doctor was condemning me to a painful condition with no resolution that ended up going on for another 6 years or more. And I could see the path unfolding. What could have been cut short was elongated far, far longer than it had to be. So I'm going to explain a little bit why that is, and also sort of accidentally lift the lid on some serious problems, not only in the medical system, but in our society. So the reason I'm in this appointment, I had this allergic reaction to the ear piercing in my right ear that I talk about all the time. And I had been on 2 months of antibiotics. They hadn't resolved the issue. There's like ulcers on it. It's still throbbing and hot and red and puffy. And now it's starting to affect my face. And dermatologists and ear specialists and my primary and whoever else could not figure this out. So I ended up in infectious disease, and he's an incredible doctor who I've seen over the years, who has helped me in so many ways. So much respect for him. He was the first to say, I'm not sure this is an infection. This might be an inflammatory illness, so we're going to send you to rheumatology. So this doctor who walked out on me is a rheumatologist. I don't have a high opinion of rheumatology, and I'm going to tell you why. But first, this doctor in the beginning was very charismatic. He put me on prednisone, something I'm a little conflicted about because it did bring down my pain level and also helped to treat an untreatable illness I'd had for more than 10 years called interstitial cystitis, which started in the same way. I'd had an allergic reaction to a medication called Bactrim for a UTI that I did not have. I took that medication preventatively. It was a sulfa antibiotic. I am genetically predisposed to be allergic to sulfa antibiotics. My mother is allergic, and it's within a few hours of taking it sparked a very painful condition called interstitial cystitis that I have yet to fully recover from. But it is being treated now accidentally because of the ear issue. And before we continue, I will just say that is a form of love from the universe. Okay, so that is a huge, not just silver lining, but gold lining of the whole situation is that my untreatable illness, interstitial cystitis, finally got treatment because of the ear issue. Moving on. I go to see this rheumatologist, puts me on prednisone, says, okay, you can't be on prednisone that long because it has all these horrible side effects. So we're going to put you on other medications that are higher level anti-inflammatories that basically interact with your immune system to stop it from creating inflammation that attacks itself. So, and these are, if you're looking at like a pyramid of medications, you have like Aleve and Motrin and Advil down at the over-the-counter level. Then you go up a level and you have stronger ones like Celebrex. Then you go up a level and you have even stronger ones that are immune modulating medications. So I'm going to mention some medication names. They're not brand names. Imuran and methotrexate. And then up at the very top tier, you have a category of medication called biologics. These are the strongest immune modulating medications. They are indescribably stronger than things like Aleve and Motrin. So biologics are hard to get. Even like azathioprine, Imuran, and methotrexate are hard to get. But biologics are extremely hard to get. There are not very many conditions that are approved for those medications. And what that basically means is that they are the only conditions that insurance will pay for, and also not just pay for, but a doctor basically cannot prescribe them to you unless they are approved. So the conditions that biologics are approved for are basically arthritis and ulcerative colitis, and very, very rarely other conditions. I can't remember the name, but so a doctor could technically prescribe it for you if you didn't have, say, arthritis or ulcerative colitis, but still needed a strong anti-inflammatory. It's just, it would be super hard and not guaranteed it would work. So first of all, insurance probably would not approve it because it's not already approved. And if insurance doesn't approve it, they're not going to pay for it. And these biologics are thousands of dollars per month. Now, there is a way around this. And occasionally you can get a doctor to fight for you and go around insurance and go directly to the drug company and ask them if they have a program for people who are not on that list of very particular conditions it's approved for, and they will put you on a program where they'll give you the medication for like $5 a month. I forget what these programs are called, but they basically are funds that are reserved to pay for your medication if you really, really need it. But you need a doctor to fight for you to get this to happen, and you need the drug company to agree, based on what the doctor said, that they're going to take this risk of putting you on a medication that the FDA did not approve for your condition. Boring, but really important, because this is what happened to me. I had a severe disabling condition that is not approved for these types of medications. It's really not approved for anything. What they tell you for erythromelalgia, which is what it ended up being diagnosed as, is, oh, you can take Motrin and Aleve. But I just explained to you in factors of thousands that these biologics are anti-inflammatories so much stronger than Motrin and Aleve that it makes them look pretty much useless. So I go to see this rheumatologist. He's a self-proclaimed expert on relapsing polychondritis, which he says it is. Relapsing polychondritis is another rare illness that affects the ear. It affects the cartilage in the ear, and it is more along the lines of arthritis, because he agrees it's relapsing polychondritis, and this is his area of expertise. He puts me on azathioprine at this high level, and I still can't come. It helps, but I still can't come off of the prednisone, because every time I taper, this thing gets worse by factors of hundreds. So it gets worse to the point where I can't get out of bed. It's disabling. I'm laying down with an ice pack on my face, a fan blowing on me. I'm in so much pain I can't think. The thing's just throbbing, even with ice on it. It feels super hot to the touch. My face is all puffy and inflamed and ulcers. And So it's bad, and we're trying to get this better. I mean, that is my motivation. I'm fighting to get better. I'm fighting to not be in horrible pain. So we keep on seeing this rheumatologist with this question of why isn't this improving? What else can we do? So what you can do is you can combine medications. You can combine two in the same category. For example, azathioprine and methotrexate create a strong combination. This is done pretty frequently. So we keep upping the ante. I need to come off this prednisone. Can we double up the meds? And he says yes, and we keep going. And every time we see this doctor, we keep asking for what else can we do, because nothing is working to the point where I can come off prednisone, and it's not even working to the point where it's resolving the symptoms. So at this point, there's this question of, well, is it really relapsing polychondritis? So I'm referred to a bunch of rheumatologists at hospitals in Denver and neurologists, and I get more incorrect diagnoses, actually horrifically incorrect. I waited months to get these appointments. These doctors were so full of themselves, they couldn't even come in the room to see me. They had medical assistants listen to my whole story. The medical assistant relayed the issue to the rheumatologist, and he came in for about 5 minutes to tell me I had trigeminal neuralgia, which is another even worse incorrect diagnosis. And when a doctor gives you a diagnosis, you can't easily question it, especially if it's a male doctor with an enormous ego who won't come in and listen to someone who's suffering. So I'm seeing a bunch of rheumatologists. I keep going back to this one who I'm assuming is helping me. And we get to this breaking point, basically, where I'm in pain, nothing is working. I'm asking repeatedly for more help. I'm aware there's a category above the category I'm in called biologics. So over and over in these appointments, I'm bringing up the idea of, can we just try a biologic and knock this thing out? I mean, arthritis is a much less you don't usually have arthritis on your face. It doesn't usually cause you to be lying in bed all day with ice packs on your face. I mean, there are other conditions where much higher level medications are more easily prescribed. And I'm in a life or death situation, and I'm having trouble getting this category of medication prescribed. So one that I'm focused on is Humira. And a lot of people probably know the name of this medication. It's advertised everywhere. People with arthritis get this medication all the time. Like all the time. Like all the time. And I'm aware that people get this medication all the time. It's not like I'm asking for something so far out of left field that it's unprescribable. It is prescribable every single day. So I'm feeling increasingly frustrated that not only am I not getting this medication, I'm in horrible pain, and I'm being dismissed by some very arrogant people who care less about my suffering and more about how awesome their wrong diagnosis is. Like they're saving my life with a wrong diagnosis. As you can tell, I'm a little heated. Just countless appointments of this happening to me. So back to this rheumatologist that I keep going back to because everything else is failing, and it's intense. I mean, it is. It's becoming an emotionally intense situation, as you can tell. And when you're in that kind of emotional intensity, when your life is on the line, when you're in that much pain, when things aren't working, when you know there are options you have not yet tried that are sort of within reach. I mean, if a doctor would take that leap with you, you could do it. I mean, I'm saying that because eventually I did. But this was before anyone would do it. And the only reason they wouldn't is because of some red tape and a very rigid, hierarchical system of medication that is blocking some of the strongest anti-inflammatories that humanity can use right now. And this is going to become a moral issue, as I'll talk about probably later in this video, of like how many people have painful illnesses in which medication like Humira is actually being held from them. I mean, I think if people realize that medication that could bring them out of that much pain and potentially disability is being withheld from them, people would be so angry that it would be so easy and fast to reform our medical system. It's not clear to everyone that medication is being withheld, though, so let's keep going with the story. I'm in this appointment. I'm asking the rheumatologist, can you please prescribe Humira? Can we please try this? Because everything else has failed. I need to get off this prednisone. I'm in horrible pain. And this is a medication that is prescribed literally every day. Like, you probably prescribed this to the person who was in here before me. That's how easy it is for some people who have arthritis to get this medication. He repeatedly dodges the question until finally his response is, I'm not a vending machine, implying he's not a vending machine for medication. Whoa. So this is rude, but what if you're very aware, what is actually happening in this situation is we have a person who was pretending to be compassionate, but at the end of the day could not actually handle pain, and ultimately could not handle pain within himself, but also could not handle the reflection of pain in the person in front of him. So his response, rather than sitting in the situation with me, which is the compassionate thing to do. If you're a doctor, I assume you go into the profession to help people who are suffering, which means you have to have a certain level of emotional intelligence to sit in that room with someone who's in actual pain and try and problem solve with them the best way to get them out of that pain, not just in the short term, but in the best case scenario, in the long term. And that is not what was happening here. Instead of allowing himself to feel pain, which is a difficult skill to do, he externalized it, blamed it back on me, and made it seem like I was asking too much of him. Like the only reason I was there was to treat him like a vending machine for pills. When in fact, I was in horrible suffering in one of the darkest moments of my entire life, reaching out to another human being, asking him to help me. And he in no way treated me like a human being. That is what was really happening there. He could not feel pain and still think clearly, maintain his empathy. I'm not sure he ever had empathy. I think maybe all of it was an act, and you went into medicine for the BMW. And that is the type of doctor I dealt with, not just with him, but on countless occasions, who if they cannot solve your condition, or if they think they have solved it with their false diagnosis and it ends up being false, it bruises their ego so bad and they can't face the actual pain of the person in front of them. So they blame that pain back on them and say, you can't heal because it's your fault. You're only here because you're treating me like a vending machine for pills. I talk about so many times how important it is to fix our dysfunctional relationship with pain. Not just because it's the mature thing to do, but because it has radical implications for how we treat each other in society and how we as human beings, because doctors are human beings too, treat their patients in the doctor's office. This doctor treated me like an object. When he blamed me for my own illness and my own suffering, he made me into an object upon which to place that blame, and by objectifying me, made it easier to cut off his empathy, reject me, walk out of the room, never come back, and essentially fire me as his patient, which I'm not actually sure doctors are allowed to do. I don't know for sure, but I experienced many situations where a doctor could not directly say, "Don't come see me anymore," but instead began treating me horribly. There was no way around this situation. There was no way I was going to see him again. But by not prescribing Humira and instead choosing to walk out of the room on me, I knew I was condemned to indefinite suffering. I knew, based on all the research I had done independently, that Humira was one of my best shots at calming down a very painful illness and coming off of prednisone sooner. Instead, because he did not prescribe it that day, I went through more than 6 years on prednisone, had to go through countless specialists until I finally found someone who would put me on Rinvoq. Rinvoq is in the same class of medication, biologics, as Humira, and was the medication that allowed me to come off prednisone and recover in 1 year's time. But since I had been on prednisone all the time leading up to that, I had broken bones. I needed surgery on both of my feet. I had cataract surgery. I had bone marrow biopsies. I had shingles for about a year that I was almost hospitalized for. I gained more than 50 pounds of weight. My face was swollen to 5 times its normal size. I had high blood pressure, high blood sugar, fatty liver disease. Most of this is caused by prednisone. And I had the chance to cut not just the illness short, but also the time I spent on prednisone that it wreaked havoc on my body and my life and put me on disability. It took 6 years of my life because of that doctor's inability to handle pain and place blame upon me for my own suffering. Just take a minute to sit with that, because it's hard. Like I said, I couldn't drive away. My mom and I sat in the car and she watched me cry hysterically because I knew what had happened there. I knew what had happened with blame. I knew what had happened with pain, and I knew what had happened not having someone try to put me on that class of medication. So, as horrible as that was, I do want to say that another part of the reason I'm able to be on a medication like Rinvoq is that magically in 2022, 23-ish, the FDA finally approved Rinvoq for something besides arthritis and ulcerative colitis. And it was approved for eczema. And I have eczema. So part of the reason I'm on Rinvoq is because I was approved for eczema, which again is accidentally helping my ear and the interstitial cystitis and any other potential illness that tries to spring up. It's very hard to do based on all the allergy medications, nerve medications, and high-level biologic anti-inflammatories I'm on, which is all the things I needed. That one incredible, intelligent, compassionate female doctor decided to take a huge risk, fight for me, and put me on, essentially saving my life. I mean, as much as I talk about this other rheumatologist and actually the field of rheumatology as withholding medication from me, this other immunologist saved my life. She actually saved my life. She continues to save my life. So I have so much profound respect for certain doctors and so much horrible, horrible memories of pretty much the whole field of rheumatology, which I now view as being a gatekeeper for a bunch of essential medications that they are withholding, only allowing arthritis and ulcerative colitis patients access to them. If you have an inflammatory illness, which quite a few people have these days, or a medication or an illness in which your immune system is attacking itself, it's likely that these medications are being withheld from you. If you knew that something that could save your life was being actively withheld from you for no reason other than FDA approval, which is some red tape, how would you feel? Would that make you as angry as I am in this video? Because I spent more than 10 years in pain not being prescribed these medications. It is pretty safe to say that no matter what level of spiritual awakening you're at, that is traumatizing, unfair, and absolutely immoral. I literally sat in other doctors' offices, other rheumatologists, besides this man and these other egotistical people I saw, and had a rheumatologist sit across from me, again with my mom in the room. It's not like I'm the only one there even. I have a support system. And they're sitting there being that rude to me, saying, I'm saying there are other conditions that could potentially be approved for this. Like I heard potentially this medication is being approved for eczema. And the rheumatologist would sit there and say, no, these are arthritis medications. And I would say back to her, I'm sorry, but no, I'm on the internet and there's approval going through for eczema. No, these are arthritis medications. I'm sorry, but no, these are anti-inflammatories. They affect the inflammatory pathway of the human body, where all inflammation comes from. How can you say that these are only for arthritis? No, these are arthritis medications. And this went on. And at the same time that this went on, she said, I'm taking you off prednisone. And I said, great, I'd love to be off prednisone. What are you replacing it with? Because you can't just rip me off this drug you guys put me on, or the inflammation's going to explode. No, you can't be on prednisone. It's dangerous. I'm taking you off. Great. What are you replacing it with? So that's equally as immoral. So I got stuck. I got stuck in this like crevice in the medical system where doctors overlaid false diagnoses on me. I fought back. They put me on prednisone. It was great for like 2 weeks. And then no one would prescribe medications that would allow me to come off. And then they tried to rip me off. And then I fought back. And then I asked for biologics. And they said, these are arthritis medications. And I said, I'm sorry, no, they're not. And then I got put on, the only reason I'm on this is because of this doctor, because they approved it for eczema, and because after insurance still denied me, I got put on that special drug plan I talked about in the beginning, where we had to apply directly to the drug company to ask them to put me on their special program where I paid like $5 a month to get medication directly from them for eczema. That is why I am not disabled. After a year of being on the medication, we applied again to have it covered by insurance. Insurance said no again. And so I had to call insurance and say, guys, I've been on this medication already for a year. They were like, oh, sorry, we'll approve it. So the only reason I got it approved through insurance is because I had already been on it for a year, because the drug company and the doctor and everyone else took a huge risk on me. I had to squeeze through the eye of a needle to survive. And that is why I'm better in this video. That is why my face is better. That is why the illness is better. That is why I'm able to talk coherently. Maybe. Does it make sense why this would get a little heated? Does it make sense why I would talk about doctors these ways and the medical system? This is absurd. This is absurd and immoral. We have a medical system and trained professionals who actively withhold life-saving, pain-relieving medications from people. If I had not fought so hard and seen so many specialists and sat in rooms of disrespectful, compassionless doctors and still fought back, I would probably not be alive. All because I had an allergic reaction to an ear piercing. Okay, so I'm going to end this because there's a lot more I could talk about the whole journey. But I'm just going to end this with going back to my own spiritual insights. My spiritual insights from being in pain and my feminist insights of what pain does to our societies. In my experience of pain, like I say countless times, pain is actually an eraser. It takes away our mind, our feelings, control over our bodies, even the sense of having a body. If it's really severe and you're passing out, pain takes away eyesight and consciousness. But you, the baseline of existence, the silent knower of all of that, is what remains. Pain shows you who and what you really are. And what you really are is timeless, formless, untouched by any pain, untouched by anything in life. You don't end, and you actually don't die. Your body dies, your personality might die, your soul never dies, and who you are right now has always been the same, untouched presence. Presence behind even the feeling and the sense of conscious presence. This is so powerful. Not only will this change how you see and feel pain, it will change how you interact with others. You will realize that other people are this same formless presence, that you're actually looking out behind people's eyes at your own conscious self. The self with a capital S that is the same one self in all of existence. This is even the source of formless, genderless, religionless God. The ultimate seer is not separate from who and what you are. Very profound. Not something we're usually taught about pain. We're usually taught to push it away, fight through it, ignore it, get rid of it. I'm not saying you shouldn't try and alleviate pain. The universe wants you to alleviate pain. That's why we have modern medication. But our relationship with pain, how we treat it in our lives, this is more of a feminine approach to embrace it, to allow it to peel back your masks, your false layers. Everyone has a personality. It's great to have a personality. Everyone has an ego. You're not going to kill your ego. You're just going to transform and rebalance it from the inside out, from a true place that is heart-centered, compassionate, empathetic, and literally recognizes yourself in another human being. The alternative to viewing pain that way is what Adam did to Eve from the beginning of time. When he experienced the painful situation of the fall of man, in which he's kicked out of the Garden of Eden and sees death and pain and decay and all of that, he panics and blames Eve for the fall of man. Instead of doing exactly what I just said, looking inside of himself, realizing who he truly is, and seeing Eve as that same source of presence and a total equal to himself in the divine feminine form. Had he done that, we would have an equal balance of power between men and women. We would see compassionate, human-centered, circular, feminine societies rather than only patriarchal, hierarchical, competitive societies like we see now. The reason we have hierarchies is precisely because when bad things happen, we blame other people, we make them into objects, and it's easy to place objects into a ladder of hierarchy. Some objects are better, some objects are worse, some objects are higher, some objects are lower. All of our systems are based on hierarchy, including the medical system. The hierarchy of medication I just talked about makes it very difficult for patients to access the top tier, not just based on literal diagnoses, but also based on unconscious biases and judgments we hold towards other people. A male doctor sitting in front of a young woman will not be able to accurately judge her pain level if he has not done this inner work. He will only see in the hierarchy of need that young women's pain has never been classed as serious as other people's pain. So regardless of whether or not my illness was on that list, I was a young woman sitting in front of him with less important pain than everyone else's in society. Just historically. This bias will hold true no matter what the bias is against you. For example, your race. We see that people of different races do not have the same level of medical care as people of white or light-skinned races. This is the same process of hierarchy that began by blaming Eve, making people into objects, and putting objects into a hierarchy. Not only is there hierarchy in the medical system, there is a pattern of blame between the provider and the patient. One in which the more powerful party, which is the provider, is abusing their power by blaming their inability to solve a medical issue back onto the patient, especially if that patient is female, and especially if that patient is a young female. So I was a prime target for being blamed for my own suffering, even in the doctor's office, and up against a hierarchical system that did not see my illness or my suffering as important. Basically, my life was not important. No one except my mom, who was there in every single appointment with me, cared if I lived or died. That is the blunt, actual truth. And I am actually not as angry with the individuals in this situation as you might think, but I am very angry at the system. And I am very angry at the human dynamics I just described behind and upholding the system. And it is hiding, unspoken and unseen, behind all of our problems. But you can take any situation, dial it back, and find blame, and therefore an inappropriate relationship with pain as the seed of that problem. The baseline of that problem is how we don't allow pain to find our true selves and the source of our true humanity. I read one time that women are twice as likely to survive a heart attack if a female doctor is attending to them. Ultimately, it was a female doctor who took that risk, stopped blaming me, and saved my life. The pattern of not blaming begins with women. Women have the high task of teaching everyone else how to not blame people when you're in pain. If you want to truly confound people, when you experience a bad situation, do not blame yourself and do not blame others. And that is so hard to do that I can guarantee the only way you're going to be able to do it is with the source of true strength. You do not have to survive pain. You have to collapse in pain and allow true strength and the true source of life and the true source of spirit and even the true source of God, if you want to use that word, to shine through your situation. So I'm so focused on the message I have because it saved my life. It could save your life, and it could save our society before it's too late. Hey, thanks for watching. If you want to learn more about me, you can check out my website, which is www.meet-shruti.com, linked below. Also, since I am a vastly better writer than I am speaker, I'd highly recommend checking out my book, The Hidden Value of Not Knowing, also linked below on Amazon. And of course, I'm obligated to say you should like, subscribe, comment. See you next time.